Hey, what's up guys, it's Junior, and in today's video we're going to take a look at everything you need to know about hamstring injuries, what you should be expecting during your rehab sessions in physical therapy, and how you know it's safe to return to sports. And so first things first, we have to make sure that it's truly a hamstring injury, right? And so a couple of different things that I take a look at here. Did you hear an audible pop during this injury in the hamstring, which is in the back of your thigh? Did you feel any popping sensation? Did you have to immediately stop and kind of hold on to the hamstring muscle during your movement or your exercise during your game? Did you have a previous hamstring injury? Because that does seem to increase the risk for future hamstring injuries by 2.7 times. Objectively, we want to take some measurements here. So pressing on the hamstring muscle or palpating that area to see if you experience any sharp pain, testing your range of motion and comparing that to the other side, because the hamstring does bend the knee. It does knee flexion and hip extension. We want to compare those two things in different positions, as this guy's doing here. Strength testing, again, it does hip extension and knee flexion, and so testing those movements in different positions, and then also knowing that there are no strong evidences for MRI findings to serve as a criteria to determine return to sports time after an acute hamstring strain, according to Erickson and Sherry. So knowing that's the case, and then there are things that we can do before we just go straight to MRI. And it's also very important to know that there are other potential injuries, and so that's where differential diagnosis comes into play. So we can rule out these things and know that it truly is a hamstring injury, and we treat it that way. And so if you take a look at these diagnoses, we have the proximal hamstring tendon avulsion injury. And so yes, this is a hamstring injury still, but it's a little more serious because it's a severe acute onset pain that occurs. Sorry about the technical difficulties here, but it says it occurs at the ischial tuberosities, which is by your hip. It's essentially on your butt, and that's usually due to forceful hip flexion with the knee fully extended. So a very specific mechanism of injury here. So things like falling while water skiing and athletes can definitely have that palpable defect, so they'll know when you press on that ischial tube, ooh, that's a little tender, and then there could be some bruising along the way. Their proximal hamstring tendinopathy is also another potential diagnosis that could get overseen. This is a little more gradual because of the repetitive motions that you may be doing throughout your life, and so it's more common in middle-aged or older adults, particularly in exercises like long-distance running, because of the repetitive loading of the hamstring tendon. Lumbar spine radiculopathy, this is something that really originates from the spine, and so that referred pain goes to the back of your thigh because of that sciatic nerve pain. And so this is not a hamstring injury, but it is something that can be mistreated as a hamstring injury. And then we have the adductor muscle injury. Adductors are the muscles on the inside of your thigh. So this one could be acute or gradual, but it is very close to where your hamstrings are located. So just making sure we rule these injuries out before we can dive deeper into how to treat hamstring injuries. So I started the rehab slides with progressive running because I get asked, when can I go back to sprinting? When can I go back to running? Very often with hamstring patients. And so this is just a general framework that you can consider to progress to max sprinting, right? So there are 4 stages here. Walking is the first stage. if you can walk, and if you can keep the pain below 4 out of 10, then you can proceed to the next stage here. Again, this is a very general progression. And then stage 1 for running would be slow jog to moderate speed running, which is about 25 to 50% of your max capacity for running. Stage 2 is high speed running, so you're running at a faster pace, which is about 80%. No pain there. Then you can proceed to max sprinting, which is stage 3. So again, here's a diagram that you can consider, and then a good example of a progression for running. And so start off with 20 meters of light jogging, and then go into 60 meters of stage 1 running, which is 25 to 50% of your max capacity. And then if that's been cleared, you can move on to the next phase. So you're running at stage 2 capacity now, but running a little shorter distance, and then finally move on to stage 3, which is sprinting at 40 meters sprinting at 100% capacity. So there I just gave an example of what it may look like to progress to max sprinting, and then there's indicators along the way that you can consider. Now moving on to the bread and butter of rehabilitation, which is exercises. Eccentric exercises, eccentric hamstring exercises, where you lengthen the muscle, and so you extend the knee or you flex the hip, which does the opposite of what the hamstring does when it contracts, right? But it gets stronger as it lengthens over time. You want to avoid these in the beginning because the muscle might already be torn, right? You don't want to stretch something that's already been torn, but you want to slowly introduce these exercises after pain and strength deficits in isometric knee flexion has been resolved. So if you can bend your knee and hold it against something for 5 seconds, let's just say, that could be an indicator that you may be ready to move on to the next phase, which is eccentric hamstring exercises. So extender, diver, glider, Askling L protocol is a famous rehab protocol that's used after hamstring injury. And so these set of exercises that's shown in the pictures above has been shown to reduce the return to sports time compared with conventional or multifactorial interventions. And so that's the extender, the diver, and the glider at the top. And so you could consider these exercises in early stages of rehab once you've been cleared to participate in eccentric exercises. So moving on to specific progression for rehab exercises. How do I know when to proceed or what exercises to do? Here's your answer. Like we talked about in the very beginning, hamstring works as a knee flexor and a hip extensor. And so you want to tackle the movements that hamstring is responsible for in these 3 domains here. Let's take a look at knee flexor. So we'll start there, and we'll dive deep into each of these functions. But first, take a look at when to proceed, right? At the bottom here, progress exercises individually when full range of motion is completed with pain below 4 out of 10. And so if you can do these exercises in each box with pain less than 4 out of 10 and in full range of motion, then you can proceed to the next phase of rehab or exercises. And so let's take a closer look here. Again, sorry about the technical difficulties here. Don't know why it's doing that. Alright, so this is a bilateral slider exercise here. As you can see, she's moving her feet out as she has her bottom up from the floor, and that's just one example of what you can do to start a bilateral slider exercise. And then Nordic hamstring curls are pretty famous for being effective in hamstring rehab, and it also works the eccentric knee flexor, and so you can do those as well. That's shown in this video here. So you come up in a tall kneeling position and then you slowly lean forward, right? And that really loads the hamstring. So you can do those as part of eccentric knee flexor exercises. All right, so in this video, she's doing the Asking Diver exercise, right? So it's also known as a single leg RDL exercise. But you're really loading that hamstring muscle as you're hinging your hip. And so it's working as a long hip extensor. Long hip extensor just means that you're gonna be extending your hip with the knee straight instead of the knee bent, because it's a long lever exercise. Another exercise that you can do here is the bilateral 45-degree hip extension exercise. I don't have the video for that here, but you can certainly look that up because we're still working the hip extensor, or hamstring as a hip extensor. And then you also have the Romanian deadlifts, of course, where you extend the hip and hinge at the hip with some load. And so that's another example or another progression that you can do once you've kind of cleared the first two. It's a very good one. All right, so moving on to working the hamstring as a short hip extensor. Now, you don't have your knees straight, you have them bent, as you can see. So bilateral hip thrusts like this person is doing here in this video is a good one to start with. And then if that feels okay, you can move on to unilateral hip thrusts, meaning you don't use both hips and you just use one hip. And then you can also alternate the speed and loading to make it a little more challenging for your patients depending on the needs and function. And then moving on to this slide here. So everything that we've talked about up to this point was a build up to get to this slide here, which is the most important slide. How do I know when it's safe for me to return to sports after hamstring injury? Here are some clear markers that you can utilize to know if it's safe to return to sports, and what stages you need to complete before moving on to the next stage. And so this is from the article Erickson and Sherry. You start off with tenderness or palpation. When you press on the hamstring muscle or the tendon, is it painful? If it is, you need to continue your current phase of rehabilitation program. And I'm assuming that you're already in physical therapy or already in rehabilitation program. And so if it's tender and you don't have a current phase of rehabilitation program, go to your physical therapist, go to a doctor, right? And you can start there. But you want to continue current phase of rehab program if it's still tender. If not, that's great. You can do some strength testing. So you want to make sure the discrepancy or the difference between the left side and the right side is less than 5% when you do the isokinetic strength testing in both concentric and eccentric conditions, as you can see in this picture here at the top. That's just one way to test your strength. You can use other dynamometers, but ultimately you want the difference to be less than 5%, so you can move on to the next phase. If it is greater than 5% between your injured side and non-injured side, you want to continue rehab with the emphasis on strength. So if it's below 5%, that's great. You can move on to the next phase, which is the H test. Okay, it's also known as active hamstring test, and you're performing single leg raises as fast as possible. So laying on your back. Here in this video, he's not necessarily doing the H test, but that's the position that you're going to be in with your butt down. and you want to raise your leg as fast as possible up and down to the highest point, and see if you have any fear of injury or insecurity. If you do, and you have to be honest with this one, because we're talking about your hamstring here, that's additional 1 to 2 weeks of rehab with the emphasis on neuromuscular control. So can you control and take full control of your pelvis, your hip, in different planes of motion, right? Utilizing the hamstring engagement. And so focus on that for the next 1 to 2 weeks. If you don't have any insecurity or you don't have any fear for another hamstring tear, that's great. Move on to the next phase here, which is the single leg bridge test. You want to do 30 reps. This is the test here. So you go ahead and bring your bottom up and down, up and down in a single leg bridge position. If you can do more than 30, that's fantastic. Move on to sport specific movement testing. If not, then you want to continue your rehab and put some emphasis on integrated strength, right? So eccentric control and trunk stabilization. So sport specific movement testing, this ultimately comes down to what you and your provider think it's necessary for you to be able to fully participate in sport without any pain or hesitation. So I'll leave that up to your discretion, but you want to focus on agility and sport specific drills at higher intensity, which hopefully mimics the real setting as much as possible. And then if there's no pain or hesitation, then you can finally return to sport. So that is it for today. I hope you guys found it helpful. If you have any questions regarding hamstring injuries, I will also say that this is just something to consider, and you should really ask for medical advice to the medical professionals that you work with and seek help that way. But again, hopefully some helpful information, and I will be back with my next video. Thank you.